the best care team includes you. And the best doctors in the world aren't going to be able to help you unless you're a part of the team.
I got cystic fibrosis. See, I've got cystic fibrosis.
Hello everyone. Welcome back to Staying Salty, season 4. My name's Chelsea. Can't believe we've been doing 4 seasons of this already. But if you just clicked into this and you have no idea what I'm talking about, this is a channel where it is 6 different people. We are a collaborative channel and we each have cystic fibrosis. And here we talk about different topics and give advice and our stories about living with cystic fibrosis. So I'm really excited about this season because I think this season has probably the most topics within one season that I'm super passionate and excited about. This week being one of them for sure, which is the relationship between you and your care team, which is hugely important in the CF world. Now, I've actually been to a whole bunch of different centers, I think 5 overall, and I'm going to talk about that more in next week's video. I'll link that somewhere around here because that is about moving and changing clinics. So if you want to hear about that, click that link. I'll put it somewhere around here. But here I'm mostly going to talk about the relationship between you and your doctor. And I've definitely had some negative relationships, and that was one of the reasons I moved a few times. But for the most part, I've had 2 great relationships with centers. One that I still keep in contact with, even though I'm on the West Coast now and they're on the East Coast. So if you don't really know what a CF team or center is, when you have cystic fibrosis, you don't just see one doctor. You see essentially a team of doctors and nurses, dietitian, social worker, and probably some other people I'm not naming at the moment, but it's essentially a group effort with the doctor and you. So when I say CF center, that's what I'm talking about. I definitely have had some not so good centers, and I think it's very, very important to have a center that you feel comfortable with, and building that relationship with you and your doctor is so important. But what a lot of people don't realize, it's a 2-way street. Your doctor can't just build a relationship with you without you building it with him or her. So it definitely takes a lot on the patient's part to make a relationship work. So definitely I'm going to name some things that have made my relationships work, both with the center that I'm at now, which is at UCSD, which is University of California, San Diego, and when I was being seen at Hopkins, which I know Chad is also seen at Hopkins, which obviously they're amazing, and my center out here is also amazing. And I could never, obviously I can make an entire video about how amazing they are, but I'm just gonna try and list some of the things that I think made my relationship so good with them. The first of those being a mutual trust. I think it's really important that when you do talk to your doctor, that they trust you. And when you tell them, oh, I don't feel good, this medication doesn't seem to be working, and things like that, that they trust that you're being honest. You know your body best. You know how you feel best. And they need to understand that when you come to them, that's not because you're overreacting or you are seeking sympathy or anything like that. You are trying to help them help you best. And I think the ability for them to trust you, and then for you to trust them that they're going to use that information in the most productive and helpful way, that is key. And I think that is one of the things that made my relationship so great. Another one, which is huge, is communication. I think this is kind of overlooked a lot because people think, well, yeah, I'm sitting in a doctor's office talking to my doctor, I'm communicating, of course. But I don't mean that. I mean the ability to trust your doctor without any judgment, because you can't have them treat you if they don't know the full story. There are probably aspects of your life, with whether you have CF or not, that you don't want to tell the doctor. But having the ability to tell them even things that may not be CF friendly, you know, like I go out on the weekends and I drink with my friends, things like that, and you need to be able to tell them so that they understand the full realm of what your life consists of. And if they don't know the things that they might, you know, frown upon or things like that, then they can't treat you properly. And they can tell. If you're lying to them, they can tell. It's not like they're stupid people. So being upfront and honest, even about maybe the things that you don't think they'll really agree with, is super important so that they can help you because they need the full picture. Kind of like I said earlier, one huge aspect that's made my relationship so good with my doctors is you need to do your part. It's not a one-way street of I have a good doctor, therefore my care is good. No, you need to put in the work and the effort so that your care is good with your doctor and they can treat you as best they can. I know for me, my doctors, I've even talked to them at great length that it matters a lot to them that you're putting in just as much effort as they are, and vice versa, because I've had doctors where it seems like once they prescribe me something, they don't even factor in how it's going to affect my life. Like, oh, I'm gonna prescribe them something that's 3 times a day for an hour, here you go, and I walk out and they don't think about it. They don't think about that's adding 3 hours to my day where I already do 2 hours of treatments and everything else and exercise. But I think it's very important to have a care team that understands what they're doing, and the best way to do that is for you to talk to them and do your part. It's much more likely for them to help you when they know you're working just as hard for your health as they are. If you're going home and you're slacking and you're not doing your treatments, not doing what they say, then they're not going to really want to help you. They know that they're putting all this effort in and you're not doing your part. Whereas if you're both working as like a symbiotic relationship for your health, then it's going to work so much better because they're going to know that you're doing just as much as they are to help yourself. I know beyond that, for me, I've gotten involved in a lot of my doctor's research studies, you know, giving them extra sputum samples because I have enough to go around, and just any way I can get involved to help him. He knows that I'm committed. I want to help just as much as he's helping me, and that just shows more of the commitment to your own health. And I think that's huge, and I think doctors really recognize that. And if you want to not stand out within your patients, but, you know, go the extra mile, make sure that you're helping them just as much as they're helping you. I kind of talk about this next week, so I'm not going to get too far into it, but my last part is to be an advocate for yourself. Like I said before, no one's in your body. No one knows how you feel. No one knows what it's like to feel sick versus a cold versus an exacerbation. So you need to advocate for yourself. The best care team includes you. And the best doctors in the world aren't going to be able to help you unless you're a part of the team. They can't be just treating you constantly. You need to be contributing to the team and saying, okay, here, this is how I'm feeling. Might be working. You know, we tried this last time. How about that again? It's a constant communication and a constant contribution to the team from your side. So you can't just sit there and be treated. For CF, you have to be involved in your treatment, and that includes advocating for yourself. And unfortunately, what I've had to do multiple times is stand up for yourself if something's going wrong. If you're not being treated properly, there's an ambulance outside. Sorry. It's still going. Take your time. It's fine. Don't worry about it. But, what was I saying? Oh, if you are being treated and there's something wrong, you have to speak up. No one else is going to speak up for you. So, both positive and negative, you need to be the advocate for yourself because you only get one body. They may have multiple patients, but you have you. You have one body and you have to take care of it. And so sometimes if you have to be that stern, mean person about it, that's okay because you're your own advocate and you need to be a part of that team And if they don't include you in a team, that might not be a team that I'd want to be a part of. But I've been very fortunate to have 2 great centers. I still work very closely with Hopkins. I was actually just there not too long ago helping them fundraise for their CF research aspect of their center. And I love giving back just as much as the doctors and centers give to me. So I keep in contact with all of them that I've had good relationships with. And I love the ones that I go to now and I keep in contact with. And I think it's very important to find how you can make your relationship with your doctor work. And maybe you need to sit down for an hour and just say, look, let's talk. But if that's what you need to do, that's what you need to do. And I hope some of my tips have helped. If you don't have a good relationship, I hope that it works out, and I hope that you get the care that you need, and I hope all of you are well. So I hope you enjoyed this video, and I will talk to you next week with our video on moving and changing clinics. So, all right, hope you guys have a great rest of your day. See ya.